I'm a professor at UCSF, and I run the program on reproductive health and the environment. Oh my God, you don't know? #1 in NIH funding among public universities. Oh, we're the University of California, San Francisco. And yay! And the program Reproductive Health and the Environment, we are focused on healthy children and healthy babies and healthy families, but we have to address the fact that they're all exposed to toxic chemicals. Therefore, we do solution-oriented research and take that research and make it workable for the clinical and policy communities. So that is us. And you already heard about this, that sperm count has been going down dramatically over the last 30 to 40 years, that reproductive health capacity is a challenge right now. Higher rates of testicular cancer, lower sperm count, a higher increase in women and families who are having difficulty in conceiving and maintaining pregnancy, along with the other chronic health conditions that Laura already talked about. So I'm going to use my time on something else, which is, we talked a little bit about this, but the change that Laura discussed is one of the changes that have happened dramatically since the 1950s. This is focused on the global plastic production. It mirrors the production of industrial chemical use in the United States and globally. But I wanted to use this because it's about plastics. And the other thing is interesting, also make sure if I'm pointing, is that a biggest percentage of this is around growth is in the packaging, just the packaging part of this. So we have a challenge. I also wanted to point, people haven't really talked about this whole relationship between plastics and the petrochemical industry. I did a talk on related to climate change at a UC meeting, but I had to dig through this because I'm going to talk to you about this chemical you've already heard about, phthalates, but it's a precursor to all these plastics and plastic packaging that we're talking about. But here are the people who are producing it: gas, oil drilling, fracking, et cetera. So I think it's important to think about this when we're talking about these life cycle issues, to be thinking about, here's the real life cycle. And so we're all exposed to these chemicals. This is from work we've done showing that pregnant women are exposed to multiple chemicals all at the same time. Some of them, most of them we've talked about during the wow, we've only been here for a day, and it seems like we've learned so much content. But there's flame retardants, there's the phthalates, which I'm going to talk about. There's some of these perchlorate, which you've already heard about, the perfluorinated chemicals. All these exposures are happening to all the pregnant women in the United States. And this is from some work that was done by the National Cancer Institute. So pregnant women are exposed to them. Placenta is not a barrier. It gets into the baby. People are measuring these chemicals in the cord blood, in the infant. So this is a quote from the National Cancer Institute. If you don't know it, you should use it all the time because it's very compelling, which is, to a disturbing extent, babies are born pre-polluted. So we've heard about phthalates. Phthalates are an industrial chemical. I think you talked about how they can affect testosterone levels. I made this really dorky slide. Oh, it's not going. So when the phthalates go into, yeah, pretty good, right? That is it's not a drumstick. It's a right, it's a club. Thank you. Someone was like, "What is that? A drumstick?" Anyway, so. It makes, basically when you're exposed to phthalates, it interferes with the development of testosterone. Testosterone levels go down, and that you need testosterone to have proper male reproductive development. Laura did a nice job talking about anogenital distance, which I'm only going to mention briefly. There's a lot of science on phthalates. I'm going to talk about why it takes so long to get from the science to actually doing something, but first I'm going to start with this National Academy of Sciences report. So one of the things we really need is to have succinct summaries of the science so that when we talk to a doctor or we talk to the public or we talk to a policymaker, we can say, here's what the science says. So here, based on an evidence-based systematic review of the evidence that the National Academy of Sciences did, they said exposure to phthalates are presumed to cause decreases in fetal testosterone and anogenital distance in humans. Was that pretty close, but I'm going to translate this, which means phthalates increase the risk of male reproductive health effects, decreased testosterone, feminization, which Laura talked about. That means male birth defects, fertility challenges, and testicular cancers. So I see in this circle is like the things that are going up in the population. Okay, so this is from an EPA report, which I just want to say, even though we will talk about some of the challenges that federal agencies have, there are lots of people working in these federal agencies, and sometimes they put hidden nuggets in their reports that we can then talk about as being official language from the U.S. Environmental Protection Agency, which is from a report called America's Children and Environment, which says the major route of human exposure to phthalates is food. So this actually then is like, well, how are people getting exposed to phthalates through food? And this is from a study that was done by colleagues at UC Berkeley and GW and led by Julia Wachowski, who is a postdoc with us now. And that one area where we're seeing the contribution of phthalates to food is in dining out. So people who dine out or eat fast food or eat processed food have higher levels of phthalates than people who eat food that's been prepared at home. And this is children, teenagers, and adults. These people eat out a lot. These people eat at home. These are the phthalate levels. Higher levels of phthalates compared to lower levels eating out. And we think it's because maybe it's the food packaging. There's a lot of unknowns about this, food packaging, but also the processing that goes into these food. I just wanted to also add something else from this study, which is that teens eat a lot at cafeterias. I have had teenagers. I did let them eat school lunch. I'm trying not to feel bad about it. Because they get a lot of this is a phthalate exposures. A lot of their phthalates can come from these cafeterias. So these are from fast foods, and then these are from restaurants. So we can actually determine some of the sources of these phthalate exposures by the places that they're coming from. And this represents an opportunity for an intervention, at least in terms of trying to think about places to reduce some of those phthalate exposures. Okay, so then what happened? So we did this study. We know that phthalates are a problem. We wanted to see where they're coming from. A big source of them are food, eating food. You get more of it when you eat processed or packaged or food not prepared in your home. So then we published this paper, and we got a front page article in the Chronicle because two of the universities involved are from California. So that's Dianne Feinstein, and she says, we need a law. She literally read this on the front page of the newspaper and then said, okay, I'm going to introduce a bill to remove harmful chemicals from food packaging. See how easy it is? Not really. But I have to say, you were like, how come you keep doing this job? And I'm like, because every day a surprise happens. So this was kind of surprising, but I just want to say it's pretty effective. This, like, doing the science, if you're thinking down, like, what's our challenge? We want to know about these chemicals. We know they're harming health. We have to, figure out where they're coming from. And then you communicate it, and then you can be sometimes very effective in going that next step to reducing them from wherever it is that you're concerned from. Okay, so I'm just going to turn to the challenge that we have ahead, which is so phthalates. You get exposed to food. They're in food packaging. People talked about the issue of regrettable substitutes. Use one kind of phthalate. A lot of this work that I talked about is on two of these type of phthalates, dibutyl phthalate and dioxyhexyl phthalate and butybenzyl phthalate, which are very complicated names. But I think it's really important to think about where are leverage opportunities for policy change. We focus on policy change because that is a driver. It's an innovation driver, right? If the government sets the bar, the industry innovates to that, and it also is a more equitable way to deal with these exposures because once you set the bar low enough, everyone benefits. So the Toxic Substances Control Act, Leo did a nice presentation about that. And I just want to say that one of the things they're doing is they put these chemicals on their list that they're actually going to do risk assessments on. Those risk assessments will determine what the levels will be what's going to be considered the safe level in the United States, and it will preempt any actions by the states. So the states will not be able to do anything on these after this is done. You see some of these phthalates coming up? dibutyl phthalate, butabenzyl phthalate, da-da-da. This one's pretty interesting, phthalic anhydride. This actually is the precursor to all these. It's like the phthalate mother or father. I don't know. Anyway, so this is the one that's going to be used to make all these other phthalates. So it's super important in terms of thinking down the road to be engaged in how's EPA going to be doing their assessments of risk. Here's what the challenge is that we've also focused on at UCSF. This is the American Chemistry Council. I just took this from their webpage today. Their myth is that the myth is that phthalates are unsafe. So they're saying phthalates are safe. This is a challenge when we're trying to interpret the science. This person up here, Nancy Beck, used to work for the American Chemistry Council. She now runs the program that makes all the decisions about the implementation of the Toxic Substances Control Act. I'm not even going to go the rest of the way. So here's something else we do at UCSF. This is the UCSF Industry Documents Library. It's a library. If no one has been there, I encourage you to go there. It includes industry document collections for the tobacco industry, the pharmaceutical industry, the sugar industry, and now the chemical industry. And so we're using it as a way to do documentation and scholarship around how does the industry try and influence science. So you've already heard, I'm talked about phthalates. We've had other chemicals we've all talked about. It's clearly a challenge in terms of the many chemicals that we are consuming through our food products. So we have a wicked problem that I'd like to talk about, and we're not going to all clean it up by ourselves. Even though we really are like inspired by Netflix. Maybe we should just have a Netflix show about this. And then, therefore, where we are going is to, this idea that we definitely want recognition about the importance of why food packaging can influence your health, and that I've only really looked at the tip of the iceberg, and we're moving down a path of having a more complete scientific information, but making the science more usable for the public, but really making it actionable for policymakers. So this says we need the government to do its job so I can be healthy. And with that, I'd like to thank everyone at PRE and Julie Franceschi who did the work on the paper that's referenced in the slides. And you can follow us. Thanks.